Hi there, I hope you are feeling good. Welcome to this video. So this is for 3 to 5 weeks after your Caesarean section. So I'm hoping that since I met you last, you're feeling a good bit better. Often a lot of that recovery happens in that 2 to 3 weeks in terms of sort of turning a little corner and feeling a bit better. But don't worry if you're still a bit stiff. Remember, it takes 6 to 8 weeks for your tissues to heal. So even if you sprain an ankle, that's how long it takes for things to heal. So you're really still healing and recovering. So I hope that you're still keeping in mind that you need to roll over onto your side before you get out of bed, and that you're taking it easy around the house, that you still manage to delegate all those housework tasks, and that you're keeping it to minimal. But I appreciate that you're still probably lifting your baby, obviously, that there's a little bit of light housework that you probably can't get away with. You may have those older kids, you may be trying to get around the place, and you may not be able to recover as perfectly as you would like. So again, this video is all about bringing in a little bit of activity, switching on those muscles so that when you hit that 6 week to 8 weeks postnatal mark, that you're not suddenly thrown into this whole idea of, yep, get back to normal exercise, off you go. So we're going to lie down onto our backs, and we're going to start with what we left off with, which is our pelvic tilting, okay? So you're just gonna roll back, lifting your tailbone and roll forward. So I'm hoping that this is completely comfortable now. Roll all the way forward, get that little arch in your back, roll back and roll forwards. All the way back and forwards, and keep getting that movement going. So as I keep saying, everybody's very individual at this point in time. So this is 3 to 5 weeks, but this may be for you 3 to 6 weeks, 4 to 7 weeks, whatever suits and whatever you feel comfortable with. So we're just going to wake up the muscles a little bit more today, but again, take your time with it. So come into your halfway position, and we're just going to focus on our breathing. So as you breathe in, your tummy rises. And as you breathe out, your tummy falls. Breathing in, nice tummy rise. And breathe out, and getting that breath right down to your tummy. Breathe in. And breathe out. And as I'm talking, you just breathe in and breathe out. And we're going to start bringing our attention to the pelvic floor. So the pelvic floor and the deep tummy muscles and the diaphragm and your deep back muscles are all connected to form your core. When you go back to your exercise after 6 weeks, there'll be a lot of talk about activating the core. So really important that you know exactly what that means, so you can just jump into a class situation where you don't have one-on-one, but you have that information from doing these videos and being prepared. So we're going to bring our attention to the pelvic floor. So the pelvic floor is the base of your core. With the Caesarean, that pelvic floor has been left intact. So although you may have had an emergency Caesarean, you may have gotten to the stage where you're pushing, you may have dilated your cervix, you may have pushed for a little while, and then everything might have just reversed and you might have gone the Caesarean route. You've also had the impact of the pregnancy where your groin bump has been just sitting down on the pelvic floor. So it will have had a stretch, it will have had an effect from the hormones, and it will need to be worked on. So we're going to bring a bit of pelvic floor work into our rehabilitation phase, and also remembering that the pelvic floor switches on your deep tummy muscles, and they will have had that little injury through them through the surgery. So the surgery will have gone through your skin, through your fascia, through your ligaments, through the layers of muscle, all the way down to that transab muscle that we're going to work now. But that muscle is a muscle that comes across your tummy. So really important muscle to strengthen. Don't worry about the likes of diastasis recti. We can do a little tummy check. We can do that in a little while. But I'm not worried about that, because either way, whether you have a diastasis, and we're saying most of the time people do at this stage, that we're looking at treating it no matter what it was, and we're looking at bringing back normal strength even if it wasn't, okay? So breathing in, feel your tummy rise. As you breathe out, your diaphragm is going to move upwards, and we're going to bring the pelvic floor with it. So breathe in and breathe out, pulling up through your back passage and your front passage as you're breathing out, and holding it there for 5, 4, 3, 2, 1, and release. Okay, so in the first few weeks, we did a little bit of pelvic floor strengthening. We're going to build on that and try to get in some pelvic floor routines. So breathe in to prepare. And breathe out, pelvic floor and diaphragm moving upwards. Pull up strong and hard through your back passage and your front passage, and hold for 10, 9, 8, 7. Keep breathing. So around the 5 mark, you're going to breathe in and breathe out. 9, 10, and release, and let everything soften out. If you bring your hands onto your hip bones, so your pelvic bones that are jutting out, come in an inch and down an inch, which brings you right down towards your pubic bone. Hands spread out across your tummy. Breathe in and breathe out. As you activate your pelvic floor, you should feel a gentle little switch on of those deep tummy muscles. So just a light sort of pressure under your fingertips, holding there, going through the pelvic floor. 5, 4, get the breath in. 3, 2, and 1, and release. So what we don't want is a big clenching through the tummy. What we do want is to feel that gentle flickering and that gentle switching on of those deep tummy muscles under your fingertips. And the best place to feel that, because that's where they become more superficial, is off the pubic bone, off the pelvic bone, in inch and down inch, and releasing for your relaxed phase of the pelvic floor. So breathe in again. And breathe out. Pull up strong and hard through your back passage and your front passage. So again, you've good intact pelvic floor. Use that strength. Let that guide the contraction through your deep tummy muscles. Holding it there. Make sure around the 5 mark you get that nice little breath in and out. 2, 1, and release the whole lot. Lovely. So these deep contractions of your tummy muscles are really, really good preparation when you increase it later on in your recovery. Breathe in. And breathe out, pull up strong and hard. So getting that power in the pelvic floor for 8, 7, 6, 5. Get a little breath in where your ribs are going to lift and lower. 3, 2, 1, and release. So nice release. Sometimes these exercises feel a little bit boring. You feel like you're doing a million other things in the world, but these are such a good investment of your time. Breathe in. And breathe out, pull up, 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 strong and hard for 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Release. And start thinking to yourself, do you feel the squeeze? Do you feel the release? Okay, so when you're thinking about your 6-week checkup down the line, thinking about whether you need to also incorporate a pelvic floor checkup, again, to repeat, the pelvic floor is intact after cesarean, but that doesn't necessarily mean it's going to be perfect. So if you are feeling that you can't kind of connect with the technique, or you can't feel the squeeze, connect with the release and the squeeze, think about going to your physio for a pelvic floor checkup. Breathe in again. And breathe out. Pull up, 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 strong and hard, and hold for 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. And let it all go for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Breathe in again. And breathe out. Pull up, 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 and hold for 10, 9, 8, 7, 6. Get that extra breath in. 5, 4, 3, 2, and 1. And release. Well done. And breathe in again. And breathe out. Pull up, 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 up. Breathe strong and hard for 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Release it out. Bring your knees and your heels together. Bring your arms out wide. Breathe in. And on the breath out, just building on that exercise we did the last few weeks, getting a nice little rotation. Come back through the center and rotate through the other side. You might find that you can lift that pelvis, get a bit more of a rotation through your ribs. Come back through the center and roll to the other side. Come back through the center and roll. So while we're avoiding heavy lifting, while we're kind of in those repetitive movements of looking after your baby, really important to remember to rotate. So that natural movement that we do when we're feeling perfect, you might be losing out on. So the little things like hoovering, little housework, pulling clothes out of the washing machine, they bring in rotations, they bring in nice movement, and you're avoiding those for now. So we're just going to have to get that movement into our exercise program. Come back to the center, hands back onto your tummy. And we're going to do some fast pelvic floor squeezes, okay? So without thinking too much about your breathing, we're just going to squeeze for 2 and we're going to release for 3, okay? So without thinking too much about it, let's squeeze. Pull up, 1, 2, release, 1, 2, 3. 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 Pull up. So feel the squeeze, but likewise feel the release. Pull up, 1, 2, release, 1, 2, 3. 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 2 more. Pull up, 1, 2, release, 1, 2, 3. Pull up, 1, 2, and release, 1, 2, 3. Lovely. So we've talked a lot about pelvic floor. Pelvic floor activates your core. So if you're ever in a class again in the future and your instructor says activate your core, you're going to pull up through your pelvic floor and your core is going to lead. Those deep trans-ab are going to activate. You're going to do it on the breath out. And the research says that your lower back activates at the same time. So kind of trust in that it's bringing in your deep back muscles. So we're going to add a little bit more. So you're walking by now. You might be getting out with the buggy. You might be still walking around the house, but you may be increasing it and saying to yourself, okay, over the next few weeks before my 6-week checkup, I'd like to get a little bit fitter, and that's allowed. It's in the advice you get. So we need to make sure that our core is following suit, that we're not leaving a whole pile of weakness through the center while you go out walking. Okay, so we're going to take a breath in, and on the breath out, we're going to activate the core. And as we activate the core, we're keeping our pelvic neutral, that halfway position. We're going to slide away one leg. And then as we breathe in, we're going to bring it back to the center. So breathe in to prepare, breathe out, activate your core. Don't let your back arch off the bed or off the floor. Breathe in, come back to the center. Breathe out, slide away. Breathe in, come back to the center. Breathe out, slide away. Breathe in, come back to the center. Breathe out, slide away. Breathe in, come out. And breathe out, slide away. Breathe in, come back to the center. Little pelvic tilt, roll back, roll forwards. Weigh it up how you're feeling. So again, if it's just week 3, you may have enough and you can just pelvic tilt as I do the second set. Or if you're week 4 or 5, you might want to add a few extra repetitions. So rolling back, rolling forwards, coming to your halfway position. So this is called pelvic neutral. So I'll be using that language. So just to know that that's what that means. Breathe in to prepare. Tummy is rising. Breathe out. Activate your core. Slide away one leg. So you could have a high level athlete who finds it hard to hold their pelvic neutral when they slide away a leg. Or you might find it easy. It might come naturally to you. Breathe in as you come back. Breathe out, a little extra activation. So often people will ask me, do I stop activating as I breathe in? Am I sort of switching on, switching off? And it's a good question. But what I would say at this stage is that we'll take our little rest period, and when we do, release everything. But as we're sliding the leg out, just get an extra little squeeze. Come back to the center, breathe out, reactivate back passage, front passage. Slide away, breathe in, come back to the center, one more each side, slide away your leg, breathe in and breathe out, come back to the center and just roll your knees to the side and over to the other side. Perfect, and come back to the center, pelvic tilt backwards and forwards, come into your halfway position. Okay, we're going to take a breath in, and on the breath out, keeping that pelvic neutral, activate your core through your back passage, front passage, drawing in that lower area across your tummy. So imagine you have a belt on and you're just drawing in the belt. If you're pulling in a notch, you're going to bring one leg up into tabletop. Hold it there for a breath in. And on the breath out, slowly lower down again, holding your pelvic neutral, keeping your lower tummy muscles drawn in. Breathe out, lift up your leg. Breathe in and breathe out. Little opportunity maybe for us to do a tummy check. So as you're doing this exercise, you can have a little look to see, does your tummy dome? Because that's a little sign that maybe your tummy muscles are overloaded, and it gives you a little bit of guidance as to whether you should do this exercise or whether you should hold off and maybe continue with the sliding of your legs. So just bring your hands, so your fingers a little bit wide like that, onto your tummy. So you're bringing your hands like your little finger is going to be on one side of the belly button and your index is going to be the other side of the belly button, and your fingers are just kind of spread out somewhere in between. And have a little feel around. If your tummy still feels a bit swollen or there's a lot of soft tissue still there, don't worry if you can't find the borders of your tummy muscles. But as you do a little sit-up, so lifting your head and shoulders off the bed, you might find that you feel the edges of the muscles coming in. So that's just like an edge on each side, and you'll feel that bit of pressure as the muscles come in towards the center, and you're just feeling the gap in between. So come back down onto the mat, breathe in and just have a little breath out, and just do a little sit up and feeling for the borders of that muscle. So you're looking to see that they're moving inwards. Diastasis is technically kind of described as being more than 2 fingers, but honestly at this point, once you can feel the muscles moving inwards, you're getting good recovery. If you feel that when you move the muscles inwards that your belly button domes forwards, it just gives you a nice little warning sign that you're going a little bit into overload. So continuing to roll over into your side as you get out of bed, continuing to avoid heavy lifting, just avoiding seeing that doming. That's the best advice I can give you at the moment. Okay, so breathe in, hands back on low again, and on the breath out, pulling up through your back passage, through your front passage, bring one leg up into tabletop, hold it there for a breath in, and on the breath out, activate your core and lower down. Breathe in again and breathe out. Activate your core. Bring up one leg. Hold there for breath in, and on the breath out, slowly lower it down. Breathe in, and on the breath out, lift up. Hold there and lower down. Breathe in again and breathe out, lifting it up. Hold there for breath in, and on the breath out, drop down. Slide away one leg, slide away the other leg. How do you feel that stretch position. So after a section, often people have tight hip flexors or tight quad muscles, just because when we're sore, we tend to keep everything hitched up in protective mode. So just getting used to sliding away the legs, pointing your toes, and if you can, reach your arms back overhead, resting in the palms of your hands or the back of your hands, right down on your pillow behind. Take a nice breath in, right down to your tummy. And breathe out, breathe in again. And breathe out. You might feel a stretch or you might find that it's all nice and easy, but just good to let your body know, yeah, we have got this nice extended position. And breathe out one more, breathe in again. And breathe out, bend up one knee, bend up the other knee, reach your arms up towards the ceiling, breathe in. And on the breath out, activate your core, drop your arms back overhead, breathe in, semicircle the arms, breathe out, reach back overhead, breathe in, semicircle the arms. And if you're feeling strong, breathe in. And as you breathe out, slide away a leg and drop back your arms. Breathe in, bring in your heel, bring back your arms, breathe out, slide away the other leg, drop your arms back, breathe in and breathe out, slide away. Breathe in, come back to the center and breathe out, slide away the leg. Breathe in, come back to the center. Really nice pelvic tilt backwards and forwards. And we're just going to roll over onto our side. Your knees are bent in front, ankles, hips, shoulders in line, reaching forwards with your arms. Take a breath in, and on the breath out, just lift up with that top arm, open out through your chest. So getting a nice rotation into your upper body and getting a little bit of movement into the pelvis, maybe a little bit of tension through the tummy muscles. Breathe in and out, breathe in again, and breathe out, breathe in again, and breathe out, come back to the center. Breathe in again and breathe out, reaching back, open out through your chest. That's it, all the way back. Hold there for breath in and out. Breathe in and out again, and breathe in and out again. Come back to the center, and one more. Breathe in and breathe out, reach all the way back, open out through your chest. Breathe in and out, breathe in and out again, and come back to the center. Okay, so if you're finding it a little bit stiff, you can just roll over onto the other side and face away from me. You know the exercise, you can hear my voice, but for the purpose of the video, I'm just going to swing myself over the other side. If you feel like you need to see me, just come around onto your side, slowly swing your legs around and roll over onto the other side. So with or without your pillow, your knees in front, hands reaching forwards, take a breath in, and on the breath out, lift up that top arm, open out your chest. So we're trying to get nice rotation. We spoke earlier on about how we don't rotate as much when we're resting. Breathe in and out, breathe in again, and breathe out. Get that lovely stretch, breathe in, and on the breath out, come back to the center, breathe in again, and breathe out, reaching all the way back, open out your chest. Really good, holding it there for breath in and out, and in and out again. One more, and come back to the center, and one more. Breathe in, breathe out, rotate and reach, opening out your chest. You are getting a little bit more tension through your tummy, so just go with it. Breathe in and out. So everything is starting to heal well, so don't worry about anything with the stitches, or they're probably dissolved by now or removed. Breathe in and out, breathe in again, and come back to the center. And we're just going to come up into sitting. So using that top arm, push yourself up and just swing your legs to either side. Drop one arm down, side bend up and over, getting a nice stretch to the side, and switch to the other side. Come back to the center. Give your shoulders a nice little roll, reach forwards, bring your arms up and around. And if you're happy enough, just coming up onto your knees, give your shoulders a roll, reaching forwards between the shoulder blades, getting a nice stretch, reach up, drop one arm down, side bend up and over, and switch to the other side. So getting a little bit more mobility through the center, and one more to each side, getting a nice stretch and over to the other side. Lovely. Give your shoulders one more roll, reaching forwards. Take a big breath in as you reach up. Bring your arms apart and just do a little bit of rib raises. So lifting each side Perfect. Give your shoulders a roll. Keep them nice and low. Bring your ear over to one side. Get a nice little stretch along the side. And over to the other side. Perfect. I hope you feel good after that. Even try to do this video 2 or 3 times a week. It's just going to help to restore your normal movement, help to switch on your core. But again, you're still only 3 to 5 weeks after your section. You have a small baby, you're recovering from surgery, and you want to make sure that the emphasis still is on that recovery period. So try to get a point during the day where you lie down for half an hour every day. Make it your business. You may be a very, very busy person or somebody who just doesn't like the idea of lying down to go to sleep in the middle of the day. Try to do it. Think of rest as a really important part of your exercise program. And I'll see you back here for that last phase of your sort of prepare to recover, really, from 5 weeks to 7 weeks or 8 weeks to when you get back to thinking about your normal exercise. Okay, I'll talk to you soon. Take care.